We're now recording. Thank you so much for joining us today for our third Careers Ed Day panel. This one is specific to skincare practitioners coming from the angles of dermatologist and esthetician. Um, Hopefully, I've captured everything, but maybe I'm not and I'm just ignorant. But, anyways, I'm going to start off with my first question, which is, would you mind introducing yourself? Who are you and what do you currently do? Caroline, would you like to go first?
Yes, absolutely. So my name is Dr. Caroline Robinson. I'm a dermatologist based in Chicago and founder of a practice here called Tone Dermatology. And a little about me, I'm born and raised in Chicago and really wanted to come back to the city after my training to just serve the community in terms of dermatologic care, but also advocating for a number of issues. So I'm very passionate about diversity in medical education and in dermatology. And I also have subspecialty interests in alopecia, which is hair loss, and issues that disproportionately affect skin of color.
Aegean, would you like to go next? The question was, would you mind introducing yourself and what you currently do?
Sure. My name is Aegean Chan, and I am a board certified dermatologist and dermatopathologist. I actually just opened a practice with my husband. So I primarily specialize in medical dermatology. So about 95% of my practice is seeing patients from pediatric patients to elderly patients. I do skin checks, treat skin cancers, rashes, acne. So, really, the full gamut of dermatologic diseases. I have a interest in rashes that are associated with chemotherapy. Treatments as well as infectious diseases of the skin. That's my particular passion. I also really enjoy treating patients with acne as well as eczema, people with chronic skin diseases of that nature. I also do dermatopathology. So that pretty much entails looking at the samples that other dermatologists send in. I look at that under the microscope and provide a diagnosis depending on the microscopic findings that we see. So that is about 30% of the work that I do, and I really, really enjoy that as well, working with clinicians and getting to the right diagnosis for patients. Um, and I also do teaching. I teach the residents at USC, their dermatology program. And so mentorship, education, and then on my social media platform, doing more kind of, I would say, more common education for people with just general skincare questions. I felt like that was a better platform in order to uh, kind of give more background and education on these common skincare questions that I don't necessarily have time for in my daily practice. So that's kind of become a significant part of what I do. So that's pretty much, and I'm located in Santa Barbara, California.
And last but not least, Renee.
Hey everyone, really nice to be here. Happy Sunday. So I am Renee Rouleau and I have been an esthetician for over 30 years. I started a company 25 years ago. We just celebrated our 25th company anniversary in August. And I have a skincare line. So when I first became an esthetician, I went to school. I learned about dry, normal, and oily skin types as well as Fitzpatrick skin types. But once I became an esthetician, I realized the skin was a little more complicated than just the simple concerns of dry, normal, and oily. So I determined there were 9 different types of skin, and I built a skincare line based on those 9 skin types. So my line spans 50 products, and people can take a skin type quiz at reneerouleau.com and find their perfect curated routine. I also started a blog, at least 15 years ago, or probably 20 years ago now, it wasn't called a blog, and now it's called a blog when the word became popular. But I consider myself a skincare educator. So I have this very popular skincare blog. I'm still always creating new content for it. And it's for, a place for people who are skincare enthusiasts or skincare professionals can learn about my experience working with skin hands-on and all these years. So yeah, that's kind of how I spend a lot of my days now is pushing out content to help others become smarter with their skin. And I'm based in Austin, Texas.
So I guess my first question, past introductions, and I mean, you guys have kind of alluded to this already, but can you describe what you do in your career? What does a typical day in the life or day in the week look like? Caroline, do you want to kick this off again?
Sure. The part of the reason that I pursued dermatology in the first place was because of the breadth of the field. So every day is really different. Every patient encounter is really different, and that I find that exciting. So in my practice, I see majority skin of color patients. So really, um, an area that's very underserved in dermatology, and so I can see patients with very common skin conditions like acne and eczema. But I also see very, severe or advanced conditions like scarring, alopecias, and, the other day we saw a patient with scleroderma who had never been diagnosed. That's a affects the deeper tissues of the skin. And so I think that, in addition to seeing skin conditions, we're also doing a lot of things. So we can perform small procedures like skin biopsies. I also do a bit of aesthetics, so injectables, laser, radio frequency, chemical peels, things like that. So I think that every day is really an exciting opportunity to learn something, teach something, and do something different.
Aegean, would you like to go next?
Yes. So Carolyn actually very eloquently described what I pretty much do in my practice as well. I don't have a practice that's necessarily focused on just one subtype. So I do see patients that run the gamut. So, one room to the next, I can see a 3-year-old or molluscum, and then in my next room, see a 6-year-old with diffuse metastatic melanoma that's metastasized to the skin. So I echo what Carolyn was saying just about the breadth of the disease presentations on the skin makes dermatology such an exciting, compelling field. And it's the same thing for me. I never know what's going to walk through the door and what that patient's going to present with. And so that's really what I enjoy most about my job. And also, seeing patients for follow-up. So patients that came in with a rash, I see them back a month later and really, to see that, oh, I'm doing so much better. I'm no longer itchy. And just to see the impact that I've had on a person's quality of life, those are the moments that make me really grateful for my career. Clearing a teenager's acne and, these things in this, the whole practice of medicine, they're not necessarily life-threatening, but I think it's very underrated sometimes by other physicians and other specialties on how much these skin diseases impact people's lives. So, that's really what I love about the clinical aspect of what I do. And same as Caroline said, I love doing procedures as well. So being able to do biopsies and small surgeries on patients' skin. And then doing some aesthetics. I do a lot of Botox and chemical peels as well. So that's about 5% of what I do, and that's something that is also really fulfilling. And then the other piece that I do, I work with a group of pathologists at our local hospital, and I have an office there, and essentially I go and I have slides. So when your dermatologist puts a piece of tissue in a bottle of formalin, that gets sent to a lab and it gets processed It gets embedded in a little piece of wax that gets sliced up and put on a slide and stained. So I get that glass slide and I look at that under the microscope, and I look for if it's a tumor, I see what type of skin cells, what kind of cells that tumor consists of, if that tumor goes to the edges of the tissue, if it was an excision. So what I do in that aspect guides other clinicians in their treatment. And if it's a rash, what kind of cells am I seeing? Am I seeing eosinophils? Is it more of an allergic type response? So it's really, really fascinating, that aspect of it as well, just to be able to. It's almost like I have a superpower, X-ray vision, to kind of connect what I'm seeing clinically on a patient, and then being able to see what's going on under the microscope, and then communicating that to clinicians. And sometimes we do have to have a discussion and kind of talk about what I'm seeing under the microscope and what they're seeing on the patient, and coming up with the best diagnosis for those pieces of information. So that's the other piece that I do, and I really, really enjoy that as well.
And last but not least, Renee.
Yeah, so having been doing this a long time, I've transitioned into kind of a new role, but my role for a long time was I had 2 skincare spas in the Dallas, Texas area, and so I was a hands-on practicing esthetician for many, 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 many years. So working with clients. About 3 years ago, we closed both of our skincare spas. They did very well. It wasn't because of that, but our product line was just taking so much of our time, and I kind of feel like I paid my dues being an esthetician. And so so now we do not have the skincare spa locations. So now we are strictly 100% e-commerce product company. I still am a practicing esthetician, though. I have a handful of celebrity clients out in LA. So pre-COVID, I'd be out there every 6 to 8 weeks, giving skin treatments to my clients, mainly doing house calls. So I'm out there a little bit less now, post-pandemic, obviously, but I still have those clients. So I like the fact that I still keep my hands in it a bit, but the rest of my time is spent. I have 18 full-time employees. We have 11,000 square foot of office and warehouse space in Austin. And so the majority of my time is working with my team. A lot of my role in the company is being brand ambassador, educator. As I mentioned previously, I have a very popular skincare blog. So researching to put content out for that. But then also new product development. That's a big part of what I do, is create new products. I have 5 new formulations in the works. And unfortunately, with supply chain things, there are challenges that are happening in the world right now. Everything is very, very slow. But yeah, working on 5 new formulations. I think the fun part about new product development is just, it's an art form, creating a new product. I mean, it's really like, what problem are we trying to solve? There's a whole exercise that I go through just to really get my creative juices going once I'm creating a product. And so working closely with cosmetic chemists to formulate those, and then figuring out how to best launch it out into the universe. I do have an in-house esthetician that I work closely with. She's in our office in Austin, and she does virtual skin consultations. So we do, I work with her closely to make sure that she's servicing our clients with all the right knowledge. So we still have that esthetician component, but we're not actually doing hands-on services. So that's mainly how I spend my time.
And so I guess my next question is, how did you get to where you are? Were there specific educational paths required? How did you move up your career ladder? And also, you guys are all very entrepreneurial, from launching brands to launching clinics. Is this a prerequisite to succeed in your field? Caroline, do you want to go first again?
Yeah, sure. For me, it was really tough because my parents are Nigerian immigrants, so they were not really familiar with the educational system here in the States, and definitely not the higher education system. And so I had to navigate a lot of it on my own, and from applying, to college to medical school. um, Luckily, I had my older sister was very, very helpful with that, so we kind of worked together. But for dermatology, the requirements are 4 years of college, 4 years of medical school, a year of internship, and then 3 years of dermatology residency. And it's one of the most competitive residencies in the U.S. So it was really tough, but I was determined, and from an early stage in medical school, I had identified that dermatology was something that I was interested in for the reasons I mentioned earlier, and so I kind of just pursued that. And then I would say once I got out into my career, I hadn't really thought past matching into dermatology and then becoming a dermatologist. So I wasn't really familiar with the different practice settings as much. So I went into academic medicine initially, and I really found quickly that it wasn't for me. I think not everyone in medicine necessarily it is needs to like open their own clinic or be entrepreneurial in that way. And I didn't know that that's the way that I like my career would end up. But I realized quickly that I had lots of ideas, and I felt like there were things that ways we could do things more efficiently and better, and like could we be more service oriented for patients, and could we create a different environment where they're more comfortable, and partner more with them with their care. And once I realized that, I actually started planning my practice, and that was in 2019. And we launched in 2020 in the middle of the pandemic, which was pretty tough also. But also, I'm blessed that the community really supported and continues to support the practice. And like a lot of my co-panelists on here, I also have um, I call it like my second, third, and fourth job, which is social media. And so I have an Instagram account where I talk about common skin conditions, and that is also uh, take some time in addition to my being a boss in my daily practice. And I think that kind of covers it.
Aegean, do you have anything to add to that? And then also, what's the academic career like for dermatopathology, and how may that differ from dermatology?
Sure. So I will kind of second Carolyn's experience as a child of immigrants. I'm the first physician in my family as well. And so I kind of had to figure out my own way. And I went to UCLA for undergrad, which is, there are a lot of pre-meds there, and everybody kind of has different paths, and it can feel very stressful kind of being in a pack of all of these people that are trying to go to medical school. But you kind of, I feel like the best piece of advice I've heard is just to find what you're passionate about, because it's so easy to get caught up in what everyone else is doing and feel like you also need to be doing 5 different research projects and volunteering at all these places. And you end up doing too much that you're almost doing nothing at all, that you're not dedicated to anything. So I found I was happiest when I was focusing on just a few, research projects or activities or volunteering projects that I personally felt connected to and felt passionate about. So for anybody considering a career, really in anything, but in particular going towards medicine, it can be easy to try to do things for prestige or, follow advice, but you really need to feel passionate about that. So that really helped me along in my journey and kind of navigating all the various opportunities that are available to people that are going to pre-med. And I took a couple years off for research, so it's a little bit non-traditional. I spent a year after undergrad working at a big biotech company. So I was kind of like a lab technician. I did cell culture, and that actually gave me some experience in order to do some basic science lab research on the skin barrier during medical school. And I did not have dermatology on my radar. For most of medical school, I wanted to become a pediatrician. I had wanted that since I was about 12 years old. And it was funny. So, third year of medical school, you actually rotate through all different specialties, the major specialties in medicine. Um, and when I did my pediatrics rotation, I realized it wasn't a fit. And I think this is a pretty common experience for people. You go into medical school thinking you want to do one thing, and then you actually are in it and experience the day to day. And then you realize it's not a great fit. And I ended up just by chance doing a week's rotation in a dermatology clinic. And I loved it for the reasons that I said before. And so I kind of was late in the game, and I took a year off to do dermatology research at Ucsf, where I primarily was doing basic science research. And I did a post on this yesterday to kind of promote this event. But again, if you're going to decide to do a year of research, it needs to be something that you feel passionate about. Otherwise, it becomes really difficult and painful. I was lucky that I found a wonderful mentor, and I learned a lot about the skin barrier, and we did electron microscopy, and it was pretty exciting to be working on that project. But again, I had a lot of colleagues and friends that maybe ended up spending a lot of time and work on things that they didn't necessarily love. So, and then the other piece that I wanted to say is that it sounds very long and very daunting, but a good piece of advice my friend gave me is that you just start climbing the ladder and the next rungs will appear. Because I think I've actually gotten messages from people about, oh, well, I don't think I can do it. It's too much school. It seems too daunting. And if you think of all the steps all together in the big picture, it can feel very overwhelming. But if you just kind of go one step at a time, okay, what are the prerequisites for applying to medical school? Okay, I'm going to sign up for those classes. I'm going to study for these exams. And then you end up 12 years later finishing up your dermatology residency. So that mindset really helped me kind of get through all the hurdles and the board examinations and all of that. And then so after the 3 years of dermatology residency, I decided to do a year of dermatopathology fellowship. So in dermatology, after you finish the 3 years, you pretty much learn everything. You do learn some dermatopathology, you do learn some surgical skills, but there are a few subspecialty skill sets that have fellowship. So pediatric dermatology, Mohs micrographic surgery for skin cancer, and dermatopathology. So I did an additional year where I was totally focused on dermatopathology. And so I really, really enjoyed that. And my path was a little bit, I actually had at one point 5 different jobs. So, it's funny, once you're in med school, you think, okay, once I finish residency, I'm going to be set. But it's a whole other ball game, kind of navigating what opportunities there are out there. And it really depends on where you want to be geographically. Again, if you want to practice in a private setting or academic setting. So I actually got a taste of a lot of different private settings just because my husband also is a physician, so he had a fellowship to do. So I was working in a private clinic in Pennsylvania. And then I worked in several other clinics. So I think that was a very valuable experience because I was able to experience how different people could run their clinics and what different practices could look like. And my husband and I started our own practice just a few months ago. So it's fairly new. We're in the thick of it. I'm wearing many hats. If you call our clinic to make an appointment, sometimes I will be the one answering. I sometimes assist my husband in surgery. So we're in startup mode, and it's been really, really wonderful. doing that, but I digress. Back to dermatopathology, I did the 1 year, and for dermatologists, you could either do a full-time dermatopathology position, which is not so common to find. A lot of dermatologists still enjoy practicing clinical medicine, so you can really structure it however you want. Many dermatopathologists and dermatologists, many dermatologists practice both. They do both clinical and read pathology, often within, like a private practice setting, and they read pathology for the group. That's probably become the most common kind of employment situation for dermatologists that also are dermatopathologists. And then in terms of just working in the private practice setting, I second what Carolyn says. You don't necessarily have to be entrepreneurial, but I think what happens is with larger institutions, there can be a lot of red tape and constraints around how you practice. So I found when I was in different clinics that, the front desk personnel were communicating to patients in ways that didn't necessarily that wasn't in line with my practice style, and that affects the care that I give to patients or how patients feel when they come to see you. So that's why my husband and I wanted to start our own practice, so that we could really structure it so that the patients have a really positive experience from start to finish, and we can really serve them in that way. So so far it's been really we've been really happy, and the community has been really supportive of our practice. So that's been really good, and we don't regret becoming entrepreneurs in that way. Sorry, that was very long, but I hope
And
some of that was
detailed,
helpful.
really good information. All of it was all of it, I think, was helpful. Renee, switching gears a bit, do you want to go next?
Sure. First of all, congratulations, Jan, on the world of entrepreneurship. Not easy, but fun at the same time. Yeah, so I kind of, I'd like to kind of share like the 4 buckets of kind of what I do and what most people kind of ask about. One is, how do you be the best esthetician you can be? So, there's obviously, you go to school to become an esthetician, you get your license, and then you go out into the world, and now you got to figure out where to go from there. I think a big thing that's really important is to really understand what your career path is going to be. There's a lot of things you can do with an esthetician license, meaning like some people like to travel and be an esthetician on a cruise line. Some people want to work at a medical spa. Some people want to not even be hands-on. They want to maybe sell a product line, be like a brand ambassador for a line. Some people want to work in Sephora and want to be able to have that esthetician's license to give them some knowledge. I think for me, it's, anyone who does go into becoming an esthetician, though, their goal is they just want to help people look and feel their best. So I think, really kind of looking at, I actually have a great blog about all the different kind of career paths you can take when you're an esthetician, because it's not just, it's not all just hands-on, but I think, for me, I have loved working hands-on. My best education that I've ever gotten about skin is just working with clients. It's the conversations you have, it's looking at their skin, having a regular client come back every 4 weeks, seeing changes, you learn a lot. So many years ago, I took about 2 years off of taking clients to really focus on product development. And this is probably 18 years ago or so. And I ended up, after 2 years, I was like, I really miss taking clients. And so I started taking clients again. And I realized, like, not only how much I loved it, but how much that was part of my continuing education. There's nothing more educational than real world experience. It's kind of like when you start a business. Like, you can go to business school, you can read all the books, but once you're in it, like, nothing that you read in a book or took at business school will prepare you for it. So you kind of just have to dive in, and hopefully you sink or swim. So I mean, you'll sink or swim, hopefully, swim. But yeah, so I think, that hands-on experience has really just been very crucial, because I've just seen so much, heard so much, and those conversations having with clients are just so invaluable. The next thing that people will ask me about is how to become a celebrity esthetician. So I have very high profile celebrities, and a lot of people dream of being that, like, oh, oh, Renee, I would love to be a celebrity esthetician. That, how that came to be is, my favorite life advice, which is just, you don't ask, you don't get. And there really wasn't anything magical. I just, asked, meaning I managed to track down like the phone number or email of a manager and just said, hey, this is who I am. Would this person like a facial? And they said yes. And so I think, there hasn't been anything magical. I just simply asked. And, you have to, the door will shut a lot of times and you'll hear no a lot, but you might just be lucky and get a bite one day and somebody says yes. And that's how it's worked for me. Working with celebrities, is great. It's, it's educational in itself because they're in the public eye. They're on, on TV and movies, and cameras see everything. So there definitely is some pressure, that they certainly feel, and then I feel as well, because, trying to prevent someone from never breaking out again is not an easy task. And, but, having celebrity clients certainly elevated my name and elevated my brand. And they've been great brand ambassadors for me. So that's how, we've gotten a lot of exposure, because when a celebrity, posts a picture of, her using your skincare product, naturally that gets a lot of eyeballs. So that's been really instrumental in my success. As far as starting a product line, a lot of people are like, oh, Renee, I would love to start my own product line and have my own line someday like you. That one's a little more challenging, because there's really like no place that tells you how to do it. For me, I took, while I did not attend college, I have taken cosmetic chemistry courses at UCLA throughout over the years. So I learned a lot about product development and chemistry and, ingredients, and then through trade shows and then through UCLA, just found relationships with different labs that I work with. Some of my labs I worked with for years. But that's, at the end of the day, I'm not a chemist, but you rely on really trustworthy, reputable chemists to help guide you in product formulations. And now it's a beautiful dance. They give their input, I give my input, and we know how to play really well together. But yeah, I mean, the simple answer is, how do you start a product line is, ultimately you just need to, find a lab or contract manufacturer to help guide you through the process. But I think what's really important is to try to educate yourself as much as possible, so you're giving input. Every product that I make truly has my DNA all over it and my stamp of approval. And it's because I just have a lot of knowledge after all these years. That was not the case in the beginning, but so I did rely on others for their input, but I've just learned a lot. And then the last part is, a lot of people want to start their own company. Like, oh, I'd love to have my own business someday. I think, as I mentioned before, it's, you can't read a book that's going to tell you how to, to do it. You kind of just have to, my favorite slogan is the Nike slogan, just do it. But I always encourage people not to be in a rush to start their own business. Working, Gian kind of touched on this a little bit, but, kind of seeing what other people are doing. But working for someone else is like getting paid to learn. So I always tell people, like, sure, if you're ambitious and you want to start your own place at some point, your own business, great. But like, don't be in a rush, because, you just learn so much working for someone else, and you get to learn on, you don't have to, the goal, because you don't want to make the mistakes. So if you can kind of see the other mistakes that other people make, and then that way you won't do it, you can only get that experience by being employed by someone else. So yeah, there you go.
And I guess I have one more question before I open up the floor to the audience for you guys to ask questions. So if you guys have questions now, raise your hand. So if you look at the bottom of your whatever you're listening in on, there's a hand with a little note. So you can click that if you want to come up to the stage and ask the panel questions. Alternatively, if you don't feel comfortable with it, then you can also go over to the webinar chat text channel and ask your questions there, and then I will ask your questions. So, my final question for you guys is, for someone aspiring to have a similar career as you, do you have any recommendations? And Caroline, do you want to go first again?
Yeah, absolutely. I wanted to third, maybe I don't think it's quite a second yet, but my both of my co-panelists touched on patience to some degree, and I think that that's my biggest advice to anyone who wants a career in dermatology, or even just uh, um, the entrepreneurial path that I've taken, or even with social media, just patience, because there are a lot of steps, but if you rush, if you're in a rush to think about the end goal, then the process, it doesn't really quite work, because you'll need, like, for example, in dermatology, you'll need all of those milestones, of course, in your education, but you want to take your time to kind of enjoy the process, because there won't be another, opportunity like that to learn on that level, a lot of the skills and a lot of the knowledge. And then I know, like, with Instagram, I get a lot of questions about how I built my following, and I think that with that, it's one post at a time, not focusing on a certain number, or a certain milestone in that regard. It's using each post to kind of connect with your audience, or help, explain a message or an issue that you really think is not getting enough awareness or attention, and focusing more on those pieces. And then your following will kind of come from there. So I guess that's my biggest advice.
Aegean, would you like to go next?
Sure. So I definitely second Carolyn's, or I guess fourth, Carolyn's point about patience. And that kind of goes back to what I was saying about just start climbing the ladder. And, the piece that I did touch on, but is really trying to focus on what you enjoy, because in social media, in the pre-med residency rat race, it's so easy to just try to follow somebody else's lead, or do what you think you quote unquote should be doing. But when you step back and really decide, this is what actually fires me up, what I'm passionate about, you can sustain that prolonged effort. And what I've kind of noticed along my journey is that when I'm actually genuinely interested in the topic that I'm either talking about on social media, or the topic that I'm researching, or the work that I'm doing, people notice that genuine passion, and I think that gets you farther than kind of the posturing that you can get distracted by. So if you're going to put the effort forth, make it in an area that you personally really feel passionate about and that you love. And again, it does take time. You're not going to see overnight results, and there's probably going to be a lot of you know grunt work that is associated with that you're like, this is not glamorous, this is not what I expected. But then you'll look back a year or two or 10 years later and say, wow, that was actually very worth it. So kind of as a side adjunct to that, try to be present and enjoy the times that you are interning, that you're working under somebody else, that you're learning. Because those times, now that I look back, are very, very valuable. And I almost wish I was a little bit more present for those. And then just in terms of like academics and the pre-med game, that's a whole nother ball game. And one piece that was really impactful for me is just finding mentors. that were very supportive along my journey. So medicine is part of it is who you know, especially once you get into medical school and are trying to get into dermatology, which Caroline touched on is a very, very competitive specialty. So you do have to have pretty high, I don't actually know if they're using board scores for residency, but you do have to, do very well in your medical school studies. And then, a lot of people do publish papers as well. But a really big piece is establishing relationships with mentors, and finding the mentors that you connect with that will support you along those journeys has been very, very impactful in my career. So that's another piece of advice that I would give.
And then Renee.
So I think it's important that, we all have, that you should have somebody that you look at their career and you're like, oh, I'd like to have a similar career to them. But of course, what is that roadmap? So I think it's really important to maybe identify, 3 or 4 people who you aspire to be like in their career, and then drill down into each of those people to figure out how they got, what their path was, because everyone's path is going to be different. And so learning people's paths is, listening to them being interviewed on, on podcasts, so you can really dive into what their journey was, because that will give you some insight as to how they got to where they are, because it's very hard to say, oh, I want to be like them. Well, how did they get there? So I think it's just hearing different people's journeys, and what got them to where they are today. So I think, it's just, I always love listening to podcasts. Jen, I certainly love your podcasts. I love hearing brand founder stories. How did they build their success? I think that's really, really educational, and that would be my recommendation for people trying to build their own career path.
Okay, so now to the audience questions, and we got some really, really good questions. So thank you to the audience members so far who've submitted your questions, and to those who haven't. If you have questions, now's the time. So the first question was from Connor, who asks, what, if any, experience do you all have with the intersection of aesthetics as a discipline in dermatology? For example, work between estheticians and dermatologists to coordinate treatment for patients/clients. And what, if any, ideas do you have around how that coordination should look, if it should occur at all, and what its limits should be? Interesting question. Thank you for that. Anyone want to chime in on this?
I can chime in. I love that question. Very detailed question. So I have an esthetician in my office, and I think that it's a very beneficial, relationship to have. And I think that, there's roles, and Renee can probably speak more to this, but it's definitely different in the dermatology setting, the interaction between estheticians and dermatologists versus an esthetician and practice on their own. But I can speak from the office standpoint. What we do is we have consultations, and patients can either see me or see our esthetician for cosmetic consultations, and we work really closely to develop the plan for them. And that plan could include aesthetic services like facials or chemical peels, or if they're interested in injectables, then my esthetician would then say, okay, then you would follow up with Dr. Robinson for the injectable portion of it. So we have patients who essentially have plans to see both of us at some point. And we also collaborate closely on their skincare plan. So we'll make recommendations for the antioxidants they should use, the cleansers they should use. And since we've been working together, the esthetician in my office knows kind of my preferences, and I've learned a lot from her, and our plans for skincare, for example, tend to look very similar because we're thinking similarly about these issues.
And I'll just sorry, Renee, if you wanted to go. I just had a short little thing to add for me in my practice. I don't have an esthetician in my current practice, although I have worked in practices in which we did. But for me, it's such a nice partnership to have. Especially for my acne patients that do require extractions and monthly chemical peels. I think partnering with an esthetician is really kind of a very beneficial care plan for patients.
My my history with this has been an interesting one. So as I mentioned, I've been an esthetician for over 30 years, which means I started my career as an esthetician in 1989. And back then, I mean, first of all, no one even really knew what an esthetician was. There were very few aesthetic schools. I mean, it just wasn't, as popular of an industry as it is today, a popular profession. So back then, there was zero relationships between an esthetician and a dermatologist. And, we dermatologists just viewed us as just, rubbing cream on people's faces. A facial was just for ladies who lunch, and just, we didn't offer anything valuable. So they were the experts, they were the doctors, and we were not respected in their eyes at all. So through the years, I always knew that there could be a good partnership there because we do things they don't, and vice versa. But dermatologists, anytime I try to reach out to one to kind of get some sort of collaboration going, I was always told no. So I learned early on just to not need them and just kind of, all right, well, I'll just do my own thing. Years later, certainly once, excuse me, once dermatologists were getting into more of the cosmetic side, then it kind of made sense to kind of bring in estheticians and work more closely with them. And so years later, I did have better relationships with dermatologists who would refer people to me and me to them. I never worked my skincare spas. We were not a medical spa, so we did not have a medical director or work in that capacity with a doctor. So so that's kind of been my journey. But fast forward to today, I certainly, have great relationships with dermatologists, a lot of them who I've met on social media and who refer people to my product line. And I, refer people to them for their knowledge and the knowledge they put out on social media and their education. But I think, as they have said, my co-panelists have said that, they see it as a valuable role. I think it's just really important that I always encourage estheticians not to, they need to be really clear with what they can do under their licensing. I think sometimes estheticians can pretend they're a dermatologist and they kind of know everything, but we are limited as to what we can do, and you need to find a dermatologist that you can refer people to because they offer things that you can't. And so each person needs to stay in their lane. But I think there are great relationships nowadays between both professions.
I suppose along the lines of staying in your lane, and perhaps this may be something to think about in response to this question. A little outside of the scope of careers, but relevant to each of you here. So, as audience, how can we judge who to trust on social media? There can be two dermatologists. One says, quote unquote, chemical sunscreens need half an hour to work, and the other says it works immediately. In our eyes, both are qualified. So, who do we listen to? Aegean, do you want to? Sorry, Renee, would you like to wade in?
Yeah, I mean, obviously, Jen, I know this is a conversation and topic that you hear about a lot and talk about a lot. And yeah, it's very challenging to figure out who to trust, even with estheticians as well. And I think the thing is, what makes it challenging is everybody has their own experiences. So, um, everybody has had different experiences with clients. And I know that a lot of my information, some people see as anecdotal because I don't have any scientific proof to prove it because I haven't done scientific studies on certain things. But when you're an esthetician for 32 years and you continually see something, hear something, see something, hear something from your clients, after a while you're like, wow, there's something here. Case in point, like dairy, I saw a correlation between dairy and acne, particularly cystic acne on the chin and jawline. I made that correlation really early on. I mean, literally like right out of the gate within like 2 years of becoming an esthetician. A friend of mine, you know, was she was the one that said, I feel like every time I eat ice cream, I get breakouts the next day. And so then we kind of had her kind of test it out or whatever. And sure enough, that was it. And so for years, excuse me, they said there was no correlation, and then come to find out now, it's well known that there is a correlation. So I think, it's hard to figure out who to trust, because people are preaching what they know to be true, and I think that ultimately, someone's credentials and experience, if somebody is new to the game, the reality is they're not going to have as much wisdom as somebody who's been in it a long time. And I always like say to myself about like doctors, for example, my ideal doctor is somebody that's young enough that they're still hungry to learn, but old enough that they've had wisdom. I don't want a doctor who's 75 years old, because chances are this individual is kind of set in their ways. They're not keeping up with any of the latest and greatest. Yes, do they have a ton of wisdom? Sure, but the world changes, and there may have been changes that they have not kept up with. But I don't want my doctor to be, fresh out of med school and be only 30 years old, because they don't have that wisdom. So I think there's, that's just how I always see it, is just somebody that has wisdom, but then still can kind of stay current. But I think a lot of times you just go with your gut, and when somebody is saying something that really makes sense to you. And but I don't think they're, but yes, credentials. Who is this person? Where did they get their knowledge? I think that's really important. But at the end of the day, you just have to, see what really wear your logic hat and see if something makes sense.
So in particular, the question about, dermatologists and which dermatologists to trust. The first thing is, I think on social media, it's very easy to claim certain credentials without that being true. So I know there have been certain situations where people have used the title as dermatologist, that have not necessarily received dermatology training. So that's one piece to keep in mind. And I know in the UK, you can look up on the NHS website, who's completed what training. In the US, there's a website, I believe it's called Certification Matters. So basically, you finish medical school and you do a residency, and each residency has its own board examination that's administered. And in order to be considered a board certified specialist of any type, you do have to pass that exam successfully. And those records are public knowledge. And I think there's a lot of opacity around medical training in general, and a lack of understanding of the general public of that. So I try to do some of that education on my social media page so that people are empowered to look up people's credentials. A lot of physicians have really flashy, beautiful, professional looking websites, and they do things to obscure their training. So I think one thing to look out for is, if you're a physician or somebody you're following on social media, look them up, look at their website. On my practice website, I have a very clear list of all the institutions that I trained at, what my training was there. I've seen certain physicians that have gaps, And I find that that's kind of a way to obfuscate things that they don't necessarily want to broadcast. There's some people that have only completed family medicine residencies that go on to practice dermatology and say they're dermatologists, but they are not formally trained. And that formal training actually has you learn a lot. There's a lot that goes into that training. There's a reason why it's 3 years and it's very competitive. So I think that transparency and educational path is a good way to kind of see, okay, who is this person and are they actually who they say they are? And that's really applies to everything in life. And then the other kind of thing I like to look for, because it can be difficult if somebody has a certain opinion or maybe they're not completely up to date on the literature. And I will say, as in our dermatology training, we don't learn a ton about cosmetic sciences. So the actual chemistry of sunscreens, we do learn some, but not everything, because our training is primarily focused on treating and managing medical dermatologic disorder. So learning about prescription medications, those drug interactions, how patients are affected by those, and how to treat those diseases. So even though on social media, I think primarily the dermatology content skews on the more aesthetics, cosmetic side and common skin disease side, I think a lot of people don't know that most of our training actually focuses more on the medical side of things, that it's not glamorous, but that's really the value of our training and why people come to see us as physicians. And so when on social media, when those topics are touched upon, I think the sources that people are getting their information from, even as physicians, can be variable. And depending on the physician, they can have different sources they've seen things on, and they may disseminate that information, which sometimes may be incorrect. And so I think there's no hard and fast rule, but if you see that a physician is nuanced, or if they're able to say, oh, well, I haven't heard that, can you share that study with me, and open to a discussion about looking into sources and kind of drilling down onto, okay, what does the evidence tell us? I think that is a good sign that, okay, that person's open to learning and listening, and maybe doesn't have the hubris to kind of go out of their lane and maybe say things that may not be completely accurate. So that's my take on it, and kind of two ways to kind of assess if somebody is open to learning new things.
I absolutely agree. I think two things. One, I think in dermatology in particular, we've seen on social media a lot of, you know, practitioners saying that they are dermatologists, which is why you hear like Aegean and I saying board certified dermatologist all the time, even though that's a mouthful to say. We're constantly saying that because we know that it can be confusing for people, and we want to be absolutely clear about our training and our background and our credentials. And then I think the last part that she said was so important, which is that after, at the end of the day, as a physician, we are trained to have, a critical eye and to weigh information and evidence. And if the sign of someone who you should trust and follow on any of these social media platforms is that they have maintained that skill. So I could say, like something about sunscreen today, and a study could come out tomorrow, and someone could say, oh well, actually that's not accurate. And the sign of a good uh person to follow would be that they take a look at that evidence and update their stance, or at least inform their audience of the updated information. We're not rigid. Science is, we're constantly learning new things every day. And, we have to update our opinions, just like Renee said about acne and dairy. In my training, we were taught, food doesn't play a role in acne, and we've all had to update our stance on that. So I think that's important to know as well.
I'll,
I just want to kind of,
oops.
I'm
Yep.
sorry. I just wanted to add on just an example of this is many dermatologists were taught in their training that physical sunscreens reflect and chemical sunscreens absorb. And I think being on social media and developing these relationships with people like you, Jen, and like Michelle Lab Muffin that have a lot of expertise on more of the chemical side of things and the chemistry of sunscreens, I've learned that that's not necessarily the case. And so, I know there's been a lot of back and forth about that, but that's just kind of one small example of being able to look at the data. I've looked up what Michelle's put out there and the references that she's made. I'm like, oh, actually, there's not that big of a difference in terms of mechanism between those two types of sunscreens. So,
Yeah,
100%.
and I just wanted to add for more on the front of nutrition and its impact on the skin. I had a really great roundtable on this about a year ago. That I thought it was very nuanced. It had Andrea Hardy, registered dietitian in Canada, and Anjali Mato, a dermatologist based in the UK. I think they're called consultant dermatologists in the UK. There's some this for future panels like this. I should have a more international panel because I know that the training may vary around the world, or the regulations may vary around the world. So maybe stay tuned, and I'll do this again in like a year or something. But I also wanted to mention, because I said this already, Aegean has highlighted this also, like if somebody is like frequently talking about things outside of their scope of expertise, like cosmetic chemistry or cosmetic manufacturing, chiming in about contract manufacturing when clearly they don't have expertise in it, and it's something that it's consistently happening, that should be like a red flag that maybe they're not the greatest information sources. That's my 2 cents. Sorry for chiming in. I'll get back to the questions from you guys. So the next one is for Renee, but I would be interested in the rest of the panel's perspective as well, as I know that this is something quite a few dermatologists have gone down the route of doing. What edges does taking cosmetic chemistry courses give you as an esthetician? Also, how do you deal with clients that are unhappy with their results? Renee, since this was directed to you, would you like to go first?
Sure. So yeah, taking cosmetic chemistry courses, as I mentioned, I did not attend college, but I knew what I wanted to do right out of the gate out of high school. And so I got onto my career path right away. But certainly, while I didn't go to college, I've always believed that education is everything, and that's, always going to give you an advantage. So, just knowledge that I gained from it. I mean, how I wouldn't have been able to get that on my own, just even reading a book. There's something great when you're in a cosmetic chemistry class and you're with other people and you get during lunch breaks you're talking, and it's all those conversations that are so helpful. So yeah, so obviously for a product formulator that's important, but as an esthetician, because even if you don't have your own product line, you still need to know what you're working with and what you're using on clients' faces. So that has been I've cherished all the courses that I've taken. As far as unhappy clients, this is an interesting thing because sometimes, so, and no disrespect by any means, but the reality is when somebody is trying to sell you something, case in point, some skincare products, if you go to a store, a lot of times they will tell you what you want to hear to get you to buy the product. So, through the years, I'll go into retail stores, I'll walk around, I'll talk to people, oh, what do you have that helps with large pores or whatever? And the outlandish claims that people will tell me to get me to buy the product. Now, I can't say they're, maybe they genuinely believe it, but it's like sometimes it's pretty astonishing what people will say. I mean, we all know that like there's no magic product that's going to cure anything really, right? Like you can't just, put a product on and all your pores will shrink and never be big again. But it's like sometimes it's outlandish what people will tell you. And I've always been very sensitive to that because, you know, as an esthetician, we have to be a little bit more accountable. Meaning, if I see a client for the first time, I get them set up on a skincare program for their skin type. I say, hey, you know, come back in a month. This is what we're going to do. This is our game plan. But if I'm making these really outlandish claims, oh yeah, okay, yeah, I'm going to sell you this product. It's going to get rid of all your dark circles. And then they come back a month later and they go, wait, Renee, like, you told me this was going to get rid of all my dark circles. And then I went, what am I supposed to say, right? So like, that's what I kind of love about being an esthetician is, you know, your word is everything and people are going to hold you to that. So you have to be really realistic with them because you don't want them to be unhappy and, you know, be like a used car salesman and just sell them whatever. So I hold myself accountable to my word, but also working with hands-on, you know, as many years as I have, and, you know, seeing clients month after month after month, while you do see changes in people's skin, you know, there are certain things that products cannot do for people. You know, you cannot put on a peptide face cream and expect to look like you've had a facelift. And so I'm a realist, and, you know, I mean, I'll flat out, you know, tell people, hey, listen, acne is a disease of the skin for which there is no cure. I cannot cure your acne. Now, my goal is to lessen it. My goal is to not make them be as often. My goal is to teach you what to do the minute you get a breakout so that, you know, we minimize, we make it go away faster with the least amount of scarring, and we can help do that. But I'm pretty real with, you know, and again, experience has told me what I'm capable of doing and what I'm not. And so I think I really lower people's expectations, because it's when you sell them miracles and they don't perform, then that's when they're unhappy. But particularly with acne, I think that's really the hardest thing, is that, you know, acne is not equal. All acne is not equal. And some people will respond really well to something and other people, you know, won't, or it can make it worse. And so I just have to, you know, and people know that, you know, by the time people come to me, they've already tried everything and been everywhere and they're looking for a solution. But I also encourage people to kind of, practice self-acceptance. And I talk a lot about that on my blog, and, you know, people are highly critical of themselves. And so a lot of times it's just kind of, you know, getting them to practice a little more acceptance. So hopefully that's helpful.
Caroline and Aegean, do you have anything to add here?
I think I take a very similar approach to Renee. I'm definitely a realist, and I think every time I'm speaking to a patient about their treatment plan and the results they might achieve, I just always have in the back of my mind that I want to under promise and over deliver. Like, I would rather tell them a more realistic result that they will have, and then have them be happily surprised to get more of a result than that, rather than have them be disappointed. And I can't remember what the first part of that question was, but Jen, I don't know. I just only spoke to the managing of the expectations.
I think the first part of the question was if you thought that there was advantage to getting some sort of cosmetic chemistry training as well as a dermatologist. This was geared to estheticians taking cosmetic courses. Does this give you an advantage? Would you say this might apply in dermatology?
I know that some dermatologists do pursue that. I haven't personally, so I can't speak to it, but I can imagine that. I can't imagine why it wouldn't be, a benefit.
And I mean, I think that for me, I've learned so much about the cosmetic chemistry side of skincare and skincare products on social media. You know, reading and learning from people like you and again Michelle have really given me much more depth to my understanding. You know, we do get some in our dermatology training, but it's not to the extent that I think people dive into on social media. I think people do ask a lot of really interesting questions that may not necessarily come up in my practice. And so I've learned a lot. Again, I second that. I think it would be of a benefit, you know, if you have formal courses. But then I also say the same thing, counseling, counseling, counseling. You know, even just starting a person on a retinoid, they don't just get a prescription, they get a 15-minute counseling session plus a handout to take home. Because I think managing expectations and you know, giving people a heads up of what to expect during treatment is so important. And I always like to use the analogy that a relationship with me, if we're treating a certain disease or a certain cosmetic concern, that it's a long-term relationship. It's not a one-night stand. And because I think it's unreasonable to expect that I have a magic wand and I can completely clear you and give you the skin of your dreams overnight. And so I think managing expectations is the most important way to prevent people from being unhappy.
Okay, so now my final question to all of you before we close out this panel. Thank you again for agreeing to participate. I learned a lot from you guys throughout this conversation. So my final question is, do you have any take-homes that you'd like to leave with our audience? Maybe something we've covered and you want to hit on the topic again, or something that was missed in the conversation. Caroline, would you like to go first?
Yeah, I think that the take home here is just learning different career paths, learning different practice settings. I love hearing about Renee's experience and, you know, as an esthetician. And I think that listening to all of these different paths that you can take for anyone's in the audience is very beneficial. And I love that you put this together, Jen, so that people can learn more. So I think the takeaway is just wherever you are in your journey, if you are considering pursuing a career in as a skincare practitioner, or if you're interested in medicine or aesthetics, that um, listening to all of these different experiences can really help inform the direction that you end up choosing.
Renee, would you like to go next?
Yeah, I think it's really and thank you, Caroline, for those that nice words. Enjoy listening to everyone else's perspective as well. I think the thing is you have to practice patience, and meaning like nothing has happened over. You can't get successful overnight, and everything just takes time. And it's also what your definition of success is. Like, how do you define success when you've quote unquote made it? What is that? But I just think it takes a lot of work and a lot of patience, and it's just I love it. Mark Cuban always says ideas are the easy part, execution is the hard part. At the end of the day, when people say, how'd you get to where you were? And I was like, I worked really hard. I sacrificed a lot in my life, and put in the work, just rolled up my sleeves and did it. And so I think, certainly, yeah, no success happens overnight. It's just one foot in front of the other. But I think it's just really important to have a really clear, goal of where you want to be, and taking just baby steps to get there.
And last but not least, Aegean.
So I second everything that everybody has said. Thank you for putting this together, Jen. I'm sure that your followers and our audience has learned a lot, and I would just say, in addition to what Renee and Carolyn have said, not to underestimate yourself. I think particularly with the idea of going into medicine and the long path that is required, I think it can be really daunting. And for women especially, I've just heard this experience over and over again, feeling like they can't do it, that it's too much, it's too much work, and really kind of cutting yourself down before you even take your first step forward. So I would encourage anybody that is interested in medicine to not underestimate yourself and to put the work in, to put one foot in front of the other, and that it is possible, even though it feels daunting. And then the second thing is, yeah, a lot of it is not glamorous. And I only now, after over a decade of work, feel like I'm in a place where I'm able to do and spend my time doing what I love. But I spent a lot of time kind of in the trenches doing things that I didn't necessarily enjoy, but I think that's part of setting yourself up to be in a place that you have the freedom and the independence to do the things that really, really fulfill you and spark your passion.
Well, thank you so much, Renee, Caroline, and Aegean, for agreeing to be a part of this panel, especially on a Sunday. Learned a lot from you guys, so thank you so much. And thank you to our audience for participating and being active with questions. If you guys have more questions, so there's going to be now a half hour, a little bit more than that break between now and the next panel, the final panel of the day, which is going to feature 3 different indie brand founders. Then you can ask them over on the webinar chat. And then this conversation is going to be published. I'm working on it in between the panels, putting them up on YouTube so that at the end of today, I should have all the conversations published together on a blog. So if you missed anything, then you can go back and watch the conversations again. Thank you again for joining. To everyone in the audience, I'll see you in a half hour. And to our panelists, I hope you guys have a great rest of your day. Thank you so much. Bench, 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 bench.